You've probably heard the term Ozempic hands floating around social media, but what's actually happening, and should you be concerned? Let's break down what we know. Before we dive in, a quick note. This video is for general information only and doesn't replace advice from your GP, pharmacist, or diabetes specialist nurse. Always speak with your healthcare professional for personalized guidance. So, what are Ozempic hands? It's an informal term that's emerged from patient reports online, describing visible changes some people notice in their hands whilst taking semaglutide medications. The reports typically describe hands that look more veiny, with tendons and bones appearing more prominent. Some describe the skin looking looser or more wrinkled than before. Here's the crucial thing to understand. Ozempic hands isn't an official medical condition. It's not recognized by the MHRA, and you won't find it documented in clinical trials or the official product information for semaglutide. Instead, it's a term that's come from people sharing their experiences, particularly on social media. Now, semaglutide is a GLP-1 receptor agonist. In the UK, it's licensed under the brand name Ozempic for type 2 diabetes and as Wegovy for weight management in specific circumstances. Wegovy is only available through specialist NHS weight management services with specific criteria set out by NICE. It's worth noting that Ozempic itself isn't licensed for weight management in the UK. These medications work by mimicking a natural hormone called GLP-1, which helps regulate blood glucose levels and appetite. Because they're effective at promoting weight loss, changes in appearance related to that weight loss can occur. So what's actually happening? There's no evidence that semaglutide directly changes your hand tissues or skin structure. Instead, the changes appear to be linked to weight loss itself. When you lose weight, you lose subcutaneous fat. That's the fat stored just beneath your skin. And your hands are an area where the skin is already quite thin. This means that when you lose fat from your hands during weight loss, the underlying structures become more visible. Your veins, tendons, and bones naturally become more prominent. This can happen with weight loss from any cause, not just semaglutide. It's simply more noticeable in the hands because there's less tissue there to begin with. It's also worth remembering that everyone's experience with weight loss is different. Not everyone taking semaglutide will notice changes in their hands, and the degree of change can vary considerably between individuals. Factors like how much weight you lose and your skin's natural elasticity may play a role. If you're taking semaglutide and you're concerned about changes in your hands, there are several things you can discuss with your healthcare professional. First, it's important to understand that cosmetic changes alone, whilst they may be unwanted, aren't typically a medical concern. However, your feelings about these changes matter, and they're worth discussing at your regular medication reviews. Your healthcare team can help you understand whether the changes you're seeing are within the expected range for your weight loss, and they can discuss your treatment goals with you. They might also be able to suggest approaches to skincare or other strategies, though research on specific interventions for this particular concern is limited. What's really important is knowing when hand changes might signal something that needs medical attention. You should contact your doctor if the changes in your hands are accompanied by other symptoms. These include pain, numbness, tingling, skin ulceration, weakness in your hands, or any other symptoms that concern you. These could indicate a separate issue that needs assessment. And whilst we're talking about when to seek help, you should also seek urgent medical help via NHS 111 or 999 if you develop severe persistent abdominal pain, which may spread to your back, or if you feel very unwell. These could be signs of serious complications that need immediate attention. Here's something crucial. Never stop taking semaglutide without medical guidance. If you're having concerns about side effects or cosmetic changes, speak to your healthcare professional first. Stopping suddenly, particularly if you're taking it for diabetes, could affect your blood glucose control. Your doctor can help you weigh up the benefits of the medication against any concerns you have and discuss whether continuing, adjusting, or changing your treatment is the right approach for you. To recap, Ozempic hands is an informal term for cosmetic changes in hand appearance that appear linked to weight loss, not a direct effect of the medication on your tissues. These changes can happen with weight loss from any cause. And whilst cosmetic concerns are valid and worth discussing with your healthcare team, you should seek medical advice promptly if hand changes come with pain, numbness, or other worrying symptoms. If you've experienced changes whilst taking semaglutide or you have questions about your treatment, drop a comment below. And if you found this helpful, please give it a like and subscribe to Bolt Pharmacy for more evidence-based health information.